Hello everyone, it's Kendra and today I will be walking you through my oral health care routine. I start with mouthwash. This is going to break up any of the large chunks of plaque or food in the mouth, kind of get everything out of there and also freshen the breath. I start with that, just make sure you're swishing around everywhere, both sides, front and back, and I gargle at the end. I also use a tongue cleaner at the end. Using this tongue brush in combo with the mouthwash, I feel like gives me really good breath. Most of the bacteria that causes bad breath sits on the tongue, so this helps. Next, I am going to be using floss. I use the blue floss so that you guys could see just a little bit better. I love to use a lot of string floss because to me this is the most accurate way to floss, and that is so important. So you always want to wrap around your middle fingers. This is going to help you to reach the back. So I wrap around the middle fingers, and then my thumb and my pointers can really control everywhere that floss goes. So I use those fingers and push it way to the back of that very last molar. It's kind of hard to see, but you'll be able to tell once I get closer to the front. I'm taking my thumb and that forefinger to wrap right along the edge of that tooth in a C shape. This is going to get right along the gum line area where all the plaque and bacteria likes to sit in the mouth. You want to be gentle when you go in, and you just have to go up and down a few times, and that should remove that plaque that's sitting right in that interproximal area. And as you can see, I kind of gather just this little small section of new floss every time I go into a new spot. This will help reduce transferring bacteria from one pocket area to another, especially if you have any areas of deeper pocketing like periodontal disease. Again, it's important to get behind that last molar. The molar areas are normally where people get stuff caught a lot. Especially me, that is my most plaque-filled area right in between my first molar and my second premolar. Now, some people may have a hard time getting in and out of this area, especially if you have crowding or a lot of buildup here. Now, buildup is very common to get in this area, so don't be alarmed if you have a lot of plaque or calculus buildup on the backs of those teeth. Again, this is the bottom, I feel like, is an area where plaque sits more, so you really want to make sure to get right along those edges. It's gonna get all that gross plaque out of there. See? Yuck. It may take you a little while to get the technique down, but don't worry. The more practice that you do, the better and faster you will be at it in the long run. It'll become second nature to you, I promise. Next, I'm going to be using Bite toothpaste bits. This is a sustainable company. They come in glass jars, and then they send you refill packs to eliminate the waste from the plastic toothpaste tubes. So they come in these little tabs, and you just place it in your mouth, chew on the tab a little bit. This gets it nice and gritty and kind of chalky. Took me a little bit to get used to. Then you just water down your toothbrush and go to town. So I normally start brushing just by kind of dispersing that toothpaste everywhere. The most important part about taking care of your teeth is how you are brushing, not the kind of toothpaste you are using. I repeat, not the kind of products you're using, but how you are brushing your teeth. You want to be aiming right towards that gum line, like I'm showing you here. You always want to angle that toothbrush down right where the tooth and the gum meet. Again, that's where all the plaque is going to sit. I'm doing vertical brushing here. This is going to get in those small spaces behind the backs of those teeth. And you don't need to put a lot of pressure when you're doing this. Just your thumb and your forefinger is all the pressure that you need. You don't want to push too hard or it can cause gum recession. You always want to get the biting surfaces. You can push as hard as you want there, you just don't want to be flaring your toothbrush bristles out. If your toothbrush bristles look flared out, you are pushing too hard. Again, right down in that gum line area. Small little circles. You should be brushing for about 2 minutes. I normally say pick a couple teeth, brush them for 3 seconds, and move on to the next couple ones. Then that should be about enough time. I probably brush my teeth a little longer, but that's okay. Again, on the top, you want to be right along that gum line, right up in that lip area. And you can see that circular motion going on. Also, if you're having trouble with flossing, I always tell people start with 1 day a week and add on a day as the weeks go by. Flossing is a hard habit to get into, so just take your time with it. Another thing I find with flossing is if I do it before I brush, I'm just more likely to do it in general. Also, there have been studies that show if you floss before your brush, you will get a better clean, because by removing the plaque in between your teeth, that allows all the good stuff in your toothpaste to get in between and all around those teeth. So, if you want a cleaner smile and you want to floss more often, floss first, then brush. That would be my suggestion. Again, at the very end, I kind of go all over again. I'm a hygienist, so I like my teeth nice and clean. Some more of that vertical brushing there. And then spit. Another important thing is to not rinse when you are done, especially if you're using a fluoridated toothpaste. Again, that area right down there is where buildup will be, so if you have buildup there, don't be ashamed of it. It's normal. I hope you guys enjoyed. Enjoy your nice shiny smile and have a happy day.